so much, Dr. Perez, and I really appreciate your organization of this, among many other Shark Chats that are sponsored here by the NSU College of Psychology. I am so happy to be joining you and to share and talk about a really important topic that's affecting all of us here, not just locally or at the state level, but this is a global and national issue when we talk about mental health and wellness through the coronavirus crisis. By way of introduction, just to tell you a little bit about myself. My name, again, is Tara Jungersen, and I'm a licensed mental health counselor, as well as a board-certified clinical mental health counselor. And I am currently the department chair and an associate professor here at the NSU Department of Counseling in Fort Lauderdale, Florida. So my training, I have a Ph.D. in counselor education and supervision from the University of Tennessee. My master's degree is in community mental health counseling from the University of Virginia. And I have coming to you with many years of work in the field prior to my current role. I've worked in a variety of behavioral health settings, inpatient, mental health and substance abuse treatment, worked a lot with domestic violence and gender violence, as well as private practice and some other areas in the field. My specialty relates to, clinical specialties relates to working with trauma, addiction, and some general mood disorders and other issues such as depression and anxiety. And I also come with some experience working with emergency community response. Through my training in disaster mental health, I've responded to local emergencies and crises, but as well as also with post-Hurricane Katrina, and also in Parkland with the Marjorie Stoneman Douglas tragedy. So that's just a little bit about my background, and I'm also going to invite Dr. Perez as well if he wants to interrupt at any time to please as we facilitate this discussion. So.
Perfect. Let me know when you need a poll.
Okay, I will be sure to chime in with that. So I'm really proud right now that I am in a position where I train our future mental health counselors, our future school counselors, our substance abuse counselors, and other behavioral professionals here at NSU. And I think they, as well as my colleagues in the field and in the mental health field, are going to be an integral part of helping folks, helping our communities recover as we navigate this complex road ahead of us here as a global community in the wake of this crisis. So today's presentation is intended to be kind of a general information session. It's not professional treatment or anything along those lines. However, we are going to be sharing some resources as we move forward that you can reach out and seek professional help and get some other resources as well at the end. So before I kind of go on, I was going to ask Dr. Perez to start with our next poll that we I'll flip it over as we transition.
Okay, so to get to know our audience a little bit, we're just curious who's in the room, and if you're on, let us know if you're an NSU student, faculty member, NSU alumni, NSU donor, NSU friend, potential incoming student, special guest, general public. So let us know who you are, and we're going to close this up in just about 10 minutes. We're at 65% of the vote. If you're going to go ahead and vote, please do that within the next 5-10 seconds. We're at 78%, and we're closing at 81%, and it looks like it's settled. So the results are, we have 33% are NSU students, 13% are potential incoming students, welcome. We've got some alumni, 15%, and then there are guests and special guests and general public that are right around almost 40%. So almost half the audience is our guests, so welcome to NSU.
Absolutely. Thank you so much, Dr. Perez. And again, I share the welcome for those of you. We have a wide range of attendees, and I'm really glad to hear that we have a mix of people, maybe with different interests, but we'll make the information relevant for everyone to the best of our intentions. So as I get started, when we when we talked about this topic of a mental health check, I had to kind of pause for a minute and ask myself, you know, how do you go about talking about this topic? Again, this isn't just us locally here in the Fort Lauderdale Tri-County area. It's not just our state or country. This is a global issue where so many people are experiencing discomfort or a range of emotions right now. And so I was like, how can I kind of start this off to bring a little bit of maybe relaxation or calmness to the room to kind of get everybody maybe grounded in some relaxation. So like many of us, we are maybe transitioning to our home offices and having to kind of create our backgrounds or our webcam presence. And so many of us may be using Zoom for the first time. So I've learned a few Zoom skills, as probably many of you have, and I thought about using this background here that would be bring maybe kind of some calmness and you know, peaceful thoughts as we kind of try to relax at a time of a lot of stress. However, we found that too many people's cats kept trying to claw at the screen. So elected to kind of go back, and we'll go with the bookcase background as kind of our our way as we move forward with that. And not to make light of any of the mental health challenges that people are experiencing, but so I really want to start with normalizing the wide range of reactions that folks are feeling. We are taking in all of this pandemic information. We're listening to guidelines, we're listening to suggestions. I've noticed kind of a progression through time as this crisis has evolved, as the situation has evolved. It kind of went from information changing hourly to perhaps information changing maybe every 6 hours or every half day. So I have noticed kind of a progression of this. And I want to normalize that any crisis or emergency such as this is going to, it can trigger a range of emotions and reactions. It can trigger anxiety, it can trigger fear, sadness. At the same time, it can also result in reactions on the opposite end of the spectrum. Some may notice that they have increased feelings of gratitude, of compassion, of empathy. And maybe even a desire to reach out and connect. So while I want to normalize, yeah, there's a lot of stuff out there. There's a lot of the icky stuff, and I'm not going to rainbow and unicorn this, that it's not, you know, perfect either, but there are some opportunities as we look at and honor in ourselves our feelings of gratitude, compassion, and the other things that have come out. So as we continue to talk about mental health and our reactions, and we get down to the nitty gritty, a lot of the fear, the anxiety, the uncertainty, I think it's important that we all take a moment, and many moments really, to kind of do some self-monitoring. And in a time when things feel really chaotic and it may be difficult to concentrate, it may be difficult to track things, I tend to be kind of a list maker at times. I try to kind of stay organized. And I think it would be very helpful as we look at ourselves and self-monitor, whether ourselves or sometimes others, is we've got to rate the frequency and intensity of our emotions. In other words, if we notice that we may be feeling sad or maybe anxious or even sometimes scared or fearful, I find that it's helpful to maybe rate ourselves like on a scale of 1 to 10. Number one, it's like, okay, yes, I'm feeling the emotion. I accept it. I know where it is. And then sometimes going up to, 7, 8, 9, 10, where it feels unbearable and it feels too extreme. So this is a technique used often, which is a scaling question of scaling where our emotions are in that intensity to help kind of give us a range. And as we notice then over time, we can kind of track and notice that, maybe things are improving for us. Maybe things are getting a little worse. And sometimes it's helpful, especially as we share that with other folks and other people as we work through this. As we know, we are most of us watching this are in quarantine or shelter in place, depending on what part of the country or what areas you're in. Of course, this is a voluntary confinement strategy. And we know that a shelter in place can result in various levels of distress or various levels of well-being, and a lot of things can impact this. So for some, whether or not we're sheltering alone or with friends or family can impact us. It can also be about whether or not how personally relevant the situation is. So the level of proximity that you have to the threat, or in this case, to the virus or to exposure. And so, of course, this varies for those that are first responders, those that are essential workers that are interacting with folks as part of their either professional or personal interactions, such as their volunteer work with the food lines, and et cetera. So we definitely know with disaster mental health response that the level of proximity can affect how we're coping in this crisis. Another thing that can also affect our coping is how we were doing before this emergency happened. You know, some folks may have had some issues beforehand, whether experiencing a loss or experiencing, you know, their own anxieties or other conditions. And we know that sometimes when you throw on a crisis such as this, that can tend to maybe make things a little worse. So we want to also make sure that we're checking on our friends and our family members, checking on our folks in the community, our neighbors that may need a little bit of extra connection and extra reaching out at a time like this. But the good news is the majority of people move through the phases of a disaster or critical incident, and they return to their previous level of functioning that they were prior to the incident. So you kind of get through the phase, and we know that, you know, it will get better, that there will be, I hate the phrase the new normal, but there is going to be a little bit of a level of the new normal as we cope and get back to how we were doing, with maybe a new set of skills and a new set of coping skills for this. Some other things that I want to share a little bit about responding to whether it's natural disasters or emergencies such as the pandemic is to kind of put it in the context of the phases of a disaster. And this is something that I know we as researchers, as clinicians, are kind of, in some ways, this is a new for us as we look at it and look at it in the bigger picture. For most things like a hurricane response or another incident, it's kind of a time-limited incident. In other words, yes, the hurricane comes, it hits, maybe we lose power, but we kind of know that after that, you know, after a few weeks or whatever time, that, you know, the electricity is going to get turned back on, the stores are going to come back. The extent of this pandemic here, we're still in it, and it hasn't quite had its end date yet. And that, I think, I want to normalize that brings up a lot of anxiety for folks. That this is more of an extensive hurricane, at least, but I say we do have our electricity on at this point, as well as the opportunity to have these sorts of webinars and information shares, you know, through our internet and our connections through our social media. So I want to just kind of focus on some of the things that people find helpful in a typical disaster response, which are things like increasing our goal-directed activity. Whether that's some of us gathering supplies, some of us it's making plans, it's being with loved ones, connecting with loved ones, etc. Of course, we also know too, in an emergency, in a crisis, there is such a desire for information. And that I think it's normal and it's common to want as much information as possible with that. And some experience frustration, whether it's with the response and how quickly the response and rescue comes, or as well as the amount of information or type of information they're getting from our news sources, et cetera. So it's normal and to want accurate and timely information, And it's also normal sometimes to feel some frustration, sometimes powerlessness of like, what do I do? Because sometimes the messaging can be confusing. Sometimes we get mixed messages, and sometimes we don't know what to believe. So I want to just kind of reassure people that I do think that people are doing the best they can, both the professional, the public health officials, and others, but also I want to say that when people are deciding whether or not to go out and enter a store, or to go out and decide on essential functions, such as picking up their prescriptions, or other things that have to be done to kind of to meet our basic needs of food and shelter, that people do conduct a personal threat assessment to help with their basic decision making. So I really want to encourage people to seek out accurate information from the media, from your public health officials. It's important that we have valid and accurate information, and that we do our best to control rumors, which we know how rumors can spread and how they can incite sometimes a lot more fear and unnecessary panic and poor decision making. So that's a little bit there about that. I wonder if maybe this would be a good time before I switch gears to do to open it back up for a poll.
Okay, very good. So my next poll is going to be a little bit about where people are. So I'm asking you your location. So where am I? I'm actually in Davie, Fort Lauderdale. So Broward County, Miami-Dade County, Palm Beach County, Tampa area, or other parts of Florida, Southern USA, Northeast USA, which is my origins, so where I grew up, Midwest, west of the Mississippi, or international. Oh, we've got at least 2 international. So glad that you're joining us. 77% of our participants have voted. I'm going to close this up in 5 seconds. 2, 1, 83% have voted, and you can see the results. So 37% are here in Fort Lauderdale, Broward County area, Miami-Dade, 25%, Palm Beach County, we've got a few, Tampa Bay and Florida, 13%, Southern US, Northeast, Midwest, and we have 2 international. Only 1 person is west of the Mississippi. Welcome, and great to have you here.
Thanks, Dr. Perez. Yeah, in my time west of the Mississippi as well, out in the American Southwest, I remember fondly those the beauty of that area. So nice little memory there. I want to talk a little bit about how people's own mental health, and how can you gauge your mental health and how you're doing with a response such as this. Because first off, I want to start out with a shout out to those of you that are having to manage the number of life tasks that a lot of people are having to manage at home and being confined with this. Those of you that are parents that are not only parenting, but now you have become all of a sudden full-time teachers and homeschoolers with this, while sometimes managing your own employment, sometimes school, relationships, family members, and some of you as well being first responders and essential workers. So you have my utmost respect and for what you are doing right now and what you're managing. So what I say today and in general, I want to say that within the context of, again, that people are doing the best they can with what they have right now. And we are utilizing, I think, a lot of us, a lot of patience. And so kudos to you for that. I think when we kind of look at our levels of mental health and stress, I kind of remember back to the four core feelings there's so many emotions out there. There's hundreds and hundreds of names of emotions, but they can really kind of be distilled down to four that I try to remember, and that is mad, sad, glad, and scared. When we think of emotions and we think of feelings, yeah, you can have shame and disgust, which are kind of a couple of other ones, but most emotions can be distilled down to those. And so as we self-monitor and kind of rate and scale those emotions, whether we call it fear or anxiety or depression, but we can distill it down to mad, sad, glad, and scared. And I think a lot of us have developed different coping styles and different coping behaviors for this quarantine, or sometimes some old coping behaviors may have crept back in. I look at how people are coping, whether on social media or even just talking to folks. And a lot of the common behaviors, of course, that come up are eating, consuming, sometimes even sleeping a little bit more. And I want to, you know, the best we can to try to kind of caution ourselves of, like anything, not doing too much in excess of any one direction. So something that I think is really important through this is, to the best of our ability, let's keep our brains engaged. We can't let our brains turn to mush right now, even if we are in an extended quarantine period. So one thing that I really recommend is for people to use some common, like, tracking apps to help us kind of monitor maybe our consumption, our level of exercise and movement and hydration. So for example, whether you use MyFitnessPal, which is free, or you have a Fitbit, or any sort of like app that helps you track some of these basics, such as your sleep, what you're eating, sometimes the quantity and how much you're eating, but also your movement and your exercise. And one thing that I really want to focus on for people is to focus on your hydration. And by hydration, I'm talking about water. I know there's other ways to hydrate right now, and a lot of people may be doing that, but it's so important to keep the water and hydrate ourselves, especially as our temperature, especially in Florida, gets hotter, because we get so much stress hormones during a crisis that our body naturally releases. So it's really important to drink a lot of water so that we can diffuse those stress hormones to give us a better chance of feeling calm and being able to manage some of the tougher decisions that we're going to have to make in this time. You know, another thing I've found that's kind of been helpful is looking at whatever kind of joy or pleasure or something that makes you smile at least once a day. One of my coping mechanisms, and one of the things that that's actually part of one of our theories we use, which is the Wheel of Wellness, which talks about 5 different selves that we can have that help us kind of cope with life in general, not just with a crisis. And one of the selves is our creative selves, which has a subsection called positive humor. And I know that's one of the ways I've kind of coped is as we look through social media and the memes, whether it's, or TikToks or whatever about homeschooling woes, or talking about our post-quarantine bellies, or things that people are using. I have been so impressed with the creativity and just the creativity that folks are using as a way to kind of positively cope with this. And I know as we kind of go on, maybe we'll talk about some other ways that people are coping. But I know that also some people, again, may be struggling. And that between kind of that normal sadness and anxiety and discomfort and grief, that sometimes it can get a little bit more serious and more severe, and people that find themselves that they can't cope. and they're really struggling and they've got too much on their plates. And I really want to encourage you, if you are in any level of distress and feeling the depression and having really serious sleep disorders, and if the anxiety has kind of gone over to where it's just unmanageable and panicky, and things that you just can't really keep a hold on, I want to really encourage you to reach out and seek professional help. Professional counselors or other allied mental health professionals, we are there for you, and we can be great resources to provide a means, not only for if you're having thoughts of self-harm or hurting yourself, but also even just to help kind of untangle the confusing thoughts and feelings that most of us are experiencing right now. To help us kind of, counselors and mental health professionals, it can help you and help all of us tap into our innate power that we have to regulate our emotions, to regulate our moods. And it's just one of the times, things I'm reminded of as we were doing telehealth with clients, or we're having groups online as well. To help folks, is that kind of going to counseling and having that time for yourself, it gives you just a little temporary break from this to focus on you and to be selfish and to just take care of your own needs for that time in that session. So many people are managing these multiple jobs and responsibilities and loved ones and kids and everything that's taking extra your attention right now. So I really want to encourage you to consider reaching out, and whether during this crisis or afterwards, because counseling does provide that time to focus on you, and that can help you have the opportunity to re-energize and to help face the issues that we're being asked to face. Many people have heard the metaphor that we have to put on our own masks before we can help others. So think about that as far as reaching out for some help so that you can keep your own mask on as you move forward. I'm going to ask Dr. Perez to maybe pop in and see if we can either do another poll or there we go.
Dr. Jungersen, I've started a poll, yes, and as we're having everybody participate, I just want to mention I've done incredible things with my garage, with my closets, with my landscaping. You could organize your computers. This is really a great time for us to catch up with friends and text people we haven't talked to in a long time, and connect with family. I do chair yoga with my mother, 83-year-old mother, every day at 11 o'clock. And exercise is important without exposing yourself. So 82% of the individuals have participated. We're going to close in just 3 seconds. So please get your votes in, and we're going to close this up. So how is your anxiety? 10% very low, 27% low, 45% are medium, 12% are high, and 6% are very high. And I forgot to share that, so now I shared it.
Thank you. Yeah, you know, and I think that's actually what I would expect for what we're all feeling with. This is obviously something that is unprecedented as we move forward.
I would say that a medium is great because it shows that they are alert and cautious, but we're comfortable and we're adapting. So that, I would say that's a great positive as a layperson.
Absolutely, you're absolutely right. That it's great that people are aware, and that means they're tuned in to what's going on and taking it seriously, and hopefully not blowing it off, because this is obviously something that is very real and has real consequences, as we're seeing every day with that. So that was actually kind of a perfect segue into my next topic, is looking at how to check on loved ones during this time, but also how to self-monitor our own, how we're doing. Obviously our public health experts are the ones that are giving us the formal guidelines to assist with tangible needs to prevent the spread of coronavirus. So I'm going to leave all of that to the public health experts. But instead of talking about some things we can do here, both with ourselves and also with our loved ones, I want to encourage you to set a standing appointment. If you don't have your appointment with a therapist each week, have appointments with your friends and family members and use the webcam. I've talked to a lot of folks that are doing phone calls, and that's great. And if you don't have like the webcam or the ability to do that, yes, please use the phone and call people. But there's something different about that face-to-face component, that face-to-face, just like seeing the other person, seeing the individual, making the eye contact. And it really decreases the isolation and the loneliness to have that. I would also encourage you to have some shared activities, whether you independently, with your loved ones, whether you independently have a TV show that you all watch that you get together and discuss. We're not going to talk about Tiger King right now, but or a book you're all reading, or something like that, things that you can still engage in at a distance. I've seen all sorts of online, board games and things that people can engage in across the distance. But also too, I think it's important that we dig deeper sometimes. A lot of us, when we say, "Oh, how are you doing?" and "Oh, I'm fine," that's not probably getting to the whole story. So I want to encourage people also to have some honest and authentic conversations. It's okay to not be okay right now, and it's okay to share that. And we know folks have different personalities. They have different levels of comfort with how much they want to self-disclose and talk about. So sometimes it may be that you have to initiate that part of the conversation, that you have to model that honesty and that authenticity, and say, you know what, I'm not doing okay right now. I'm really scared, or I've been really irritable and going off on my partner or something like that. And it's okay to have those honest conversations and normalize it, because this is not a normal time. I think also that kind of moves us into a lot of things that can happen. I know last week's Shark Chat had to do with the increase in domestic violence with Dr. Lenore Walker, who talked about the conflict and some of that's coming up in relationships. But I also want us to kind of talk a little bit about how to manage that piece of it, of how to be that, and focusing on the fact that we have to be patient with each other and with ourselves. This is, we're going to come out of this with whole new skill sets as far as patience. We're also going to come out of this with whole new skill sets about this, what I call this tolerance for ambiguity, because there is so much ambiguity right now, and we are coming out of this with a new skill set. I think it's also important that, yes, if we are having to quarantine, especially with a whole bunch of people in a small space, that you are going to have to get out of that house, practicing social distancing, but getting some movement, going for a walk, again, not with groups or other people per se, but to get that movement, to kind of get out, get some sunshine. I was thinking this morning, I was like, as summer's coming on us here in South Florida, I'm going to go ahead and stock up on that, on some bug repellent, because I'm going to be spending a lot more time on my porch and sitting outside, as sometimes the walls can kind of close in with that. Some other things I want to encourage, especially if you're you got a bunch of people in your place right now, is in addition to taking breaks, make sure that everyone's taking some technology breaks as well. Whether that's your screen time on your phone, on your from the TV, make sure that we're taking technology breaks, because not only the strain on our eyes from being in front of this, but also from the information overload. And in addition to technology breaks, I want to encourage us to take Corona breaks. We are bombarded with information about the coronavirus from every angle. And even when we try to tune out, I think flipping channels the other day, Ellen was on, or your favorite Late Show or whatever is on, and it's a different mentality as it comes from folks' living rooms and homes, but it's this constant reminder of this kind of invisible presence. So be sure too that you're taking some Corona breaks in addition to technology breaks as well. And just keep some folks. I know, especially since school assignments have had the students keeping a journal and keeping a kind of a diary of this experience to kind of track how they're doing. But it is a great time, whether artistically with drawing or with writing, but having that release, having that way of getting out the experience and even chronicling it for future reference. So I want to maybe wrap up before we go to Q&A here, is just again to normalize what we're all going through, and asking people again to don't lose sight of the skills that we are going to come out of this with, the experiences, that both positive and negative, that we can grow from as we move forward through this progression. So Dr. Perez, I'm going to turn it over to you for our either our poll or our Q&A.
Sure. Well, let's first take one final poll, since
Okay.
we're taking a little break. And this one is one I had a little fun with. And we are talking about when this is over, I'm going to ... Fly to London, kiss a stranger, continue social distancing, cruise the Caribbean, go out to dinner, and you know that those are some of our closest friends.
Yes.
Become politically active, pursue another degree, yay! Bar hop like I turned 21. And we're going to close that up in just a few seconds. Some tips on a personal level. I encourage people to do things with their hands. Do something creative. Paint, draw, plant something, rearrange your landscaping, read, write, rearrange the furniture, redo things, move things because it gives you a certain satisfaction. Learn a language, take a class, enhance your CV, your resume, host socials. So Zoom, Skype, GoToTraining, even Facebook has features. So I'm going to end polling in 5, 3, 2, 1. And you can see the results here. And then we're going to start taking questions. So Erica, you should join us soon, and you're going to help us out with some questions.
Sure. So we'll start with this
Hold on
one.
for a second. We're just going to share the results here. So let's see, the top is go out to dinner. A lot of people want to go out to dinner. You know, there's a lot of local restaurants that are doing takeout, and so pick curbside service. Support your local restaurants, folks. Those are really important. Hit the gym. Well, you know, you could do chair yoga, you could do push-ups, you could do plank, you could do many things.
You know, Dr. Perez, I think the bottom one, the visit loved ones, it might have gotten cut off in the screenshot, but it looks like that's going to be at 50%. Somehow it looks like it cut it off, but I think visiting loved ones, and I would agree with that, is going to see our connections and decrease that isolation, loved ones and friends as well.
Perfect. And there are all the results. And okay, we've got a student joining us. Her name is Erica. Hello, Erica, are you on?
I am. Hi.
So you're going to help us with some questions, right? I know some questions are coming in, and we've already got quite a few questions that have come in even before we requested it. So go ahead, Erica, just read what you can, and Dr. Jungersen will be assisting.
All right, sounds great. So we'll go with this one. Due to the current COVID-19 situation, we are currently on lockdown unless we need essential items. Generally, I am an extrovert and receive my energy from constant face-to-face interactions. What are some self-care strategies that I can do to lessen symptoms of anxiety or depression?
That's a great question. I kind of tend to be a little bit the same way, that extroversion. I get my energy from, you know, seeing my friends and my colleagues and kind of being out with that interaction. So I can definitely relate to that. I think it's so important right now that we have to keep a routine. Keep our routine of eating, sleeping, keeping our minds engaged. I know it's been so easy right now to let those kind of wake up times maybe creep up and creep up and creep up. Set your alarm, keep yourself kind of focused on when this ends, that you will be able to kind of get back into that routine a lot easier if you keep it through this. Exercise, absolutely. Movement, yoga, walking, push-ups, sit-ups, you know, all that. Keep that movement, or at least stretch. Even if you can't do exercise, do some sort of stretching to get the blood flowing to the different extremities. Find some activities that bring you joy. That's something that can make you smile. Whatever that is. I think there's a lot. We're going to share some websites and stuff that have a lot of ideas for what you can do, whether it's a skill to learn or something to challenge yourself with. For example, I'm pretty savvy with Microsoft Excel, but I found this training that's really going to kind of up that expertise level on having to use pivot tables and all these things. So I'm gonna kind of learn that skill. Stay away from alcohol and drugs. It's really easy to kind of want to numb out right now, and I think that that you don't want to, as you move through this, you want to look at how you handled this, and you don't want to come out of this with more problems than you need. So limit your alcohol intake, and obviously we encourage people to stay away from mood altering substances as well. If you are on medications for depression and anxiety, I want to really encourage you to continue them. I think you should plan ahead for any refills if you're already on those medications, because we know doctors and pharmacies are operating a little differently right now, between whether it's telehealth and doing your check-ins with your physician or your prescriber like this, or some pharmacies are maybe only doing mail order. So plan ahead if you're on any medications that need refills. But also, again, if the anxiety and depression has gotten really kind of off the charts, if it's not manageable, any issues of feeling like you want to hurt yourself, or that the panic or anything has become so unbearable, please seek out professional help. And we want to make sure, even if it's not bad, but we don't want it to worsen. So we, as mental health professionals, we are here, we are operational through telehealth. Hospitals are operational, and so we are here to help get you connected with others. So I don't know if that answered your question, but.
Yeah, it was a great answer. Thank you so much. So what are some ways that you have practiced self-care during the quarantine?
Well, that's a good question. I'll be honest. It took me a week or so to kind of get into to what I feel like has been a workable solution for me, because I went through, like many of us, just this period of feeling just how surreal this whole thing is. So it took me more than a minute to kind of maybe be able to answer this more fully. I have done my best to keep a routine. I shake it up a little bit on the weekends. This isn't a typical weekend because you would see me in my day pajamas right now instead of my night pajamas if this was a real Saturday. I keep a routine too. I make the bed. I open up the curtains and blinds every morning, and then I close them at night to kind of give me that separation between a day that could otherwise drag on forever. It also kind of helps that nighttime routine. It's kind of that part of letting my body know to kind of start shutting down, that it's, you know, prepping for bed, and helping me to sleep better. I am making sure, again, to get some sort of movement every day, whether I do walk or yoga or stretching. I have reached out, I've checked on my friends, they've checked on me, checked on family members. I have tried to protect myself from constant news. I do like pick maybe 1 or 2 points in the day that I'm going to, that I feel like I'm mentally prepared, that I can kind of absorb the news in kind of condensed chunks. Again, I've focused on projects. I think I shared, I was kind of doing that Excel class. We are, of course, keeping busy with our program, and our educational activities, of course, are continuing. I still have my online classes that I've had for years, because we've taught online for years with our clinical training. So I am, of course, keeping engaged and taking care of students and checking on students as well. And honestly, I've had to find humor where I can. That's how I kind of cope, is finding something that I can laugh at times as well. So, I'm not sure if that answered it, but.
Definitely. Yeah, it's been very tough for myself and others that I've talked to as well, to try and figure out ways to take care of myself and find that routine now that we're in, like you said, this new normal. So that was helpful to hear suggestions from someone else as well.
Erica, as you're reading those, we're just going to take a few more questions. And Dr. Jungersen, if you see any other questions you have there, I'd say we'd take 1 or 2 more questions.
Okay, sounds great. So we'll do this one. I think this is something that a lot of us are feeling in a couple of different ways. This one says, I keep seeing people I care about not taking social distancing / isolation seriously, and I keep hearing people talk about how everyone is overreacting with the recommendations. For the most part, they're following the guidelines, but I still see them on social media, meeting up with friends and going out on the weekends. It's getting really frustrating, and I feel like I can't really talk about it without sounding judgmental or like I'm hating on someone. What are some suggestions for relieving that frustration, or at least expressing that to someone else without sounding rude or passive aggressive?
Yeah, that's a great question. And I think there's a whole lot of different opinions on this. So I think that all of us, individually and collectively, we have to realize what we can and cannot control. We can't be the social distancing police, but we can take care of our own physical presence, our own physical boundary, so to speak. And at the same time, communicating to our loved ones, our friends, etc., our concern. I think if we come at it with anger and conflict, you know, you're going to get that sort of reaction back. But one of the skills I recommend is using what's called an I message. In other words, you use the word I feel, I think. So I feel scared when I see you around all those people on the weekend, because I care about you and I want you around. And you notice that comes across very different than you need to stop going out on the weekend. Again, there's limits to what we can and can't control. And I think you just repeat the message, I care about you, I care about the others that you're going to be in contact with, and I really want you to be around, I want you to be safe. And you can continue it, and then at some point, again, in realizing that what you can and can't control, which is sometimes an existential question, but it's also ultimately deciding that some battles are not worth the relationship, and you have to look at, do you want to preserve the relationship, and what does that want, what do you want that relationship to look like? I don't know if that's helpful or not, but that's my take on that.
So we've got a couple hands up. We're going to allow them to go ahead and email or text the messages, send it by chat. I think we are at our last question here. Erica, if you want to pick one.
From the chat, I can't see any new questions.
Okay, go ahead. All right, so Dr. Jungersen, do you have any questions on your screen that you want to answer, or are we?
Yeah, I see a couple of here. Here's a good one. It says, okay, it says I'm in a household where there is constant conflict. It's making self-isolating hard. How do I manage stress in the household during times like this? Okay, I think that's a really important question, and one that a lot of us are dealing with. I think you have to have realistic expectations. If you had an already tense situation, perhaps in your household or in your relationship, the stress here can intensify it and make it worse. So conflict you had before this quarantine is not necessarily going to go away. But at the same time, what I would suggest is there's opportunity to try to identify some patterns and try to kind of problem solve too. Since we are all in close quarters, I've spent more time with my husband than I have in our 27 years of marriage, and we're doing great. But I've also kind of noticed as I've read some of the articles about couples and about some of the household relationships that we are all in a time where any sort of conflict or pattern that we have, we're going to be doing it more frequently. In other words, if you usually maybe like had a certain discussion or whatever once a week, you might be having it 10 times a day. So this is a great opportunity to kind of like, okay, write it down. What are the themes? What keeps coming up over and over and over? It'll give you an opportunity to maybe identify, okay, is this a certain time of day that we always have this discussion or argument? Is this a certain topic that keeps coming up? So it's almost like keeping a diary of it and helping to kind of notice that. And for those of you, if you have not done this, especially whether it's romantic partners or others, I'm a huge fan of John Gottman's The 5 Love Languages. And if you haven't heard of the 5 love languages, I would really encourage you to go read about them. You can take a self-quiz. It talks about kind of your love language and how you communicate and how you want to be communicated with. And so it's really important, I think, a good opportunity right now, if you've got some extra time on your hands, to learn about that, learn how maybe some certain conflicts develop. You can apply the love languages at work or with your kids or, you know, not just romantic partners. So that's a great tool to help maybe learn about any sort of stressful conflicts you're having with folks in your house.
Dr. Jungersen, thank you so much for all that. I want to open up a slide here, which gives some resources. And I think we are going to hold on any other questions. Can you see that there?
Sure can.
Okay, great. So these are some really important resources to consider.
Absolutely. I'll just briefly just talk a little bit about SAMHSA. Has a disaster distress line, American Foundation for Suicide Prevention. 211 is a national number that has up-to-date resources, connecting to resources, et cetera, and then some others as well, locally and nationally.
So hopefully we answered your questions. We did try to take them all. I know that there was a couple that did not get answered. If you do have further questions, feel free to email psychology@nova.edu. And also tell your friends, nova.edu/shark chats for additional events. Actually, when our student was on and we had her asking questions, if you noticed, I think her dog barked. And we've got Yappy Hour coming up, where we're going to talk about utilizing or engaging our pets in our mental health, mental wellness. And we certainly encourage you to share this with your friends, and hopefully you'll join us again. Any final parting words?
I just want to remind everyone that one of my signs that one of my friends gave me that I ended up putting here in my background. It's a quote that's kind of I've been living by or reminding myself, and that is, says, "A smooth sea never made for a skilled sailor." And that has been my kind of mantra that I'm reminded of as we will all end up with being a skilled sailor.
So I'd like to thank everyone. Thank you, Dr. Jungersen. You are a wonderful colleague, and we very much enjoy having you here at Nova Southeastern University. Certainly, if you have future questions on our clinics, on our academic programs, if you're in the area, or if you're looking at things online, look into our lifelong learning programs and many things at the university. We've got campuses throughout the state of Florida, and we're an innovator in distance education, which is quite valuable these days, I would say. But again, if you have further questions, feel free to email psychology@nova.edu. Thank you. Have a great day.
Thank you, Dr. Perez. Thank you, everyone.